What causes high blood pressure? What is normal blood pressure? What health problems are associated with high blood pressure? Today, we will explore what is high blood pressure, talk about what causes it, what are the common symptoms, how to treat it, and the problems it can cause for your health. We will keep it simple and discuss about definitions, causes, symptoms, treatments, risks, and how common high blood pressure is around the world. Ready to learn more? Let's get started. Hypertension or high blood pressure affects an estimated 1.28 billion adults aged 30 to 79 globally, with two-thirds residing in low and middle-income countries. Shockingly, 46% of those with hypertension are unaware of their condition, and less than half receive diagnosis and treatment. Only 21% have their hypertension under control, highlighting its significant contribution to premature mortality worldwide. To address this growing concern, one of the global targets for non-communicable diseases is to reduce the prevalence of hypertension by 33% between 2010 and 2030. Hypertension prevalence differs significantly among various regions and income groups worldwide. Over the years, there has been a substantial increase in the number of adults affected by hypertension, soaring from 594 million in 1975 to a staggering 1.13 billion in 2015. This surge is primarily observed in low and middle-income countries, where hypertension risk factors have become more prevalent. As such, the rise in hypertension cases underscores the pressing need for targeted interventions and healthcare strategies to address and mitigate the burden of this chronic condition. Hypertension, commonly known as high blood pressure, is a prevalent medical condition characterized by elevated blood pressure levels, typically registering at 140 to 90 mmHg or higher. High blood pressure is a common condition that affects the body's arteries. If you have high blood pressure, the force of the blood pushing against the artery walls is consistently too high. The heart has to work harder to pump blood. Blood pressure is categorized into 4 general categories by the American College of Cardiology and the American Heart Association, with ideal blood pressure falling under the normal category. In this classification, normal blood pressure is defined as having readings lower than 120/80 mmHg. Elevated blood pressure is characterized by the top number ranging from 120 to 129 mm of mercury and the bottom number remaining below 80 mm of mercury. Stage 1 hypertension is indicated by the top number ranging from 130 to 139 mm of mercury, or the bottom number falling between 80 and 89 mm of mercury. Stage 2 hypertension is identified when the top number is 140 mm of mercury or higher, or the bottom number is 90 mm of mercury or higher. Blood pressure is measured in millimeters of mercury, mmHg. In general, hypertension is a blood pressure reading of 130/80 mm of mercury, mmHg, or higher. Blood pressure is influenced by the heart's pumping strength and the ease of blood flow through arteries. When the heart pumps more blood and arteries narrow, blood pressure rises. High blood pressure is categorized into primary and secondary hypertensions. Primary hypertension, also known as essential hypertension, develops gradually over years without a specific cause, often due to atherosclerosis, the buildup of plaque in arteries. Secondary hypertension is caused by underlying conditions and tends to appear suddenly, resulting in higher blood pressure than primary hypertension. Possible causes include adrenal gland tumors, congenital heart defects, certain medications, illegal drugs, kidney disease, obstructive sleep apnea, and thyroid issues. Despite its widespread occurrence, hypertension can have serious implications if left untreated, leading to an increased risk of heart disease, stroke, and other cardiovascular complications. Interestingly, individuals with hypertension often do not experience noticeable symptoms, underscoring the importance of regular blood pressure monitoring for early detection. Several factors contribute to the development of hypertension, including modifiable and non-modifiable risk factors. Non-modifiable risk factors of hypertension are aspects that individuals cannot alter or control. These factors include age, where the risk of hypertension tends to increase with advancing age; family history, with a higher likelihood of developing hypertension if close relatives have the condition; ethnicity, as certain ethnic groups like African Americans are at elevated risk; gender, with men being more susceptible before the age of 64, and women becoming more affected after this age; and genetics, where specific genetic predispositions can contribute to hypertension development. While these factors remain beyond individual influence, understanding them can aid in proactive monitoring and management of blood pressure levels. Modifiable risk factors for hypertension are aspects that individuals can actively change or manage to reduce their risk of developing the condition. These include unhealthy dietary habits high in sodium and low in potassium, insufficient physical activity, obesity or overweight, tobacco use, excessive alcohol consumption, chronic stress, sleep apnea, and medication non-adherence. However, the good news is that lifestyle modifications can play a pivotal role in managing blood pressure levels. Adopting a balanced and nutritious diet, rich in fruits, vegetables, and whole grains, while reducing the intake of sodium and processed foods, can significantly lower blood pressure. Additionally, engaging in regular physical activity, such as aerobic exercises or strength training, helps improve heart health and promotes better blood pressure control. For some individuals, these lifestyle changes may suffice to manage hypertension effectively. Nonetheless, in certain cases, medication may be necessary to achieve optimal blood pressure levels. It's essential to understand the mechanics of blood pressure readings, where the systolic number represents the pressure in the arteries during heart contractions, while the diastolic number indicates the pressure between beats. Diagnosis of hypertension typically requires consistent blood pressure measurements on different days, with readings consistently equal to or exceeding 140/90 mmHg. By recognizing the importance of early detection and implementing lifestyle modifications, individuals can take proactive steps towards maintaining optimal blood pressure and reducing the risk of associated health complications. Symptoms of hypertension often presents without noticeable symptoms, making it challenging to detect without proper screening. However, extremely high blood pressure levels, typically at 180/120 or higher, may trigger symptoms such as severe headaches, chest pain, dizziness, difficulty breathing, nausea, vomiting, blurred vision, anxiety, confusion, ringing in the ears, nosebleeds, or irregular heart rhythm. If experiencing any of these symptoms alongside high blood pressure, immediate medical attention is crucial. Regular blood pressure checks by healthcare professionals remain the gold standard for diagnosing hypertension, as it is quick and painless. While individuals can measure their blood pressure at home using automated devices, professional evaluation is essential for accurate risk assessment and management of associated conditions. Treatment of hypertension can range from lifestyle changes to taking medicines. Implementing lifestyle changes can play a significant role in managing high blood pressure effectively. These changes encompass adopting a healthy, low-salt diet, shedding excess weight, engaging in regular physical activity, and quitting tobacco use. If diagnosed with high blood pressure, your healthcare provider may recommend one or more medications to help control it. Your target blood pressure goal may vary depending on any other existing health conditions you have. For instance, individuals with cardiovascular disease, diabetes, chronic kidney disease, or a high risk of cardiovascular issues typically aim for a blood pressure reading below 130/80. However, for most people, the general target is to maintain blood pressure levels below 140/90. Commonly prescribed blood pressure medications include ACE inhibitors like enalapril and lisinopril, which relax blood vessels and prevent kidney damage. Angiotensin II receptor blockers, ARBs, such as losartan and telmisartan also have a similar effect. Calcium channel blockers like amlodipine and felodipine work by relaxing blood vessels, while diuretics like hydrochlorothiazide and chlorthalidone help eliminate excess water from the body, thus lowering blood pressure. These medications, along with lifestyle modifications, form a comprehensive approach to managing and controlling high blood pressure effectively. To prevent hypertension, adopting lifestyle changes is paramount in managing and lowering high blood pressure for individuals with hypertension. While many may benefit from these adjustments, some may still require medication. These changes serve as preventive measures against hypertension and aid in its reduction. Recommendations include increasing consumption of vegetables and fruits, minimizing sedentary behavior, engaging in regular physical activity such as walking, running, swimming, or strength-building exercises, maintaining a healthy weight, adhering to prescribed medications, and attending healthcare appointments. Conversely, individuals should avoid excessive consumption of salty foods, saturated or trans fats, tobacco use, and alcohol intake beyond recommended limits. By effectively managing hypertension, individuals can mitigate the risk of heart attacks, strokes, kidney damage, and other associated health complications. Furthermore, reducing stress levels, regular blood pressure monitoring, appropriate treatment of hypertension, and managing concurrent medical conditions contribute to lowering the risks associated with hypertension. Uncontrolled hypertension can lead to severe complications, particularly affecting the heart and blood vessels. Elevated blood pressure levels can result in the hardening of arteries, reducing the flow of blood and oxygen to the heart. This can manifest in various ways, including chest pain known as angina, or even more dangerously, a heart attack. A heart attack occurs when the blood supply to the heart is obstructed, causing heart muscle cells to die due to lack of oxygen. prolonged blockage exacerbates the damage to the heart. Furthermore, hypertension can contribute to heart failure, a condition where the heart struggles to pump sufficient blood and oxygen to vital organs. Irregular heart rhythms, which can culminate in sudden death, are also a potential consequence. Moreover, hypertension poses a risk to the brain, potentially leading to strokes if arteries supplying blood and oxygen are ruptured or blocked. Additionally, kidney damage and subsequent failure can occur due to hypertension, further emphasizing the importance of controlling blood pressure levels to prevent these serious complications.